So starting with the muscle matter of Gmax, we'll try to cover these points. There are certain points that will be there. There are certain points which are not there. Let's see what comes up for the client. Muscle accomplice are the healing techniques that we're going to cover it up. Okay, so it's a 5-point energizer, palm energizer, finger polarity, tapping, which can be this way. Okay, one at a time. So there can be tapping with one finger, left finger, right finger, neutral, left hand, right hand, whatever the body asks. Okay, essences, nutritional, emotional. There can be mineral of transformation, lotion, essential oil. Breathing can be slow, fast, deep, left nostril, right nostril, Taishin, tuning fork, color shades, Big Ten, dry needling or releases. So these are the different color shades from which one they can ask for. The more the energy, the better would be. Okay. Perfect. So the Gmax is of three division: iliac, sacral, and coccygeal. We'll be talking about 3 divisions, each one separate muscle testing. And this muscle testing is a bit different. So it will be a bit difficult for you to grasp, but not hard, since all of you are physios. Is my voice audible and clear to all of you?
Yes.
Thank you.
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
Okay. Let's muscle. The first we are doing is glute maximus iliac division. Gluteus maximus iliac division. Now here there are 3 characteristics to be understood. For the iliac division, the ipsilateral knee is 90 degree, the affected side knee is 90 degree, thigh is extended 23 degree, and femur is externally rotated 40 degrees. There are 3 characteristics: 90 degree, 23 degree extension, and 40 degree external rotation. Now there are 2 cameras that will be running. One is the front camera, which you all are seeing currently, and secondly another camera that is of admin. If you want to see that, you can see that one too. So it's your choice if you which one to see and which you can't. I have zoomed out of the slide already. So this is the affected leg, 90 degree flexion, 90 degree knee flexion. Everybody clear? So this is 90 degree. There are 2 cameras running. One is of the admin, you can check. One is on the one you all already seeing it. So its knee is 90 degree flexed, 40 degree externally rotated. Okay, 40 degree external rotation and 23 degree off the table, stabilizing the opposite ilium, making sure hamstring is not recruiting, and you'll be pushing down to the table, and you'll be pushing down to the table. That's the test of the iliac. Can you see this gap? That is 23 degree extension. Everybody clear? This is 23 degree extension. So it is, again repeating the test: knee 90 degree, external rotation 40 degree, and off the table 23 degrees. And you'll be testing the muscle. This is the iliac division of the G max. Everybody clear? Anybody who's still not clear, I'll repeat one more time. If the test is clear, we'll go ahead with the next point. Everybody clear with the test?
Sir, please explain.
Please explain again, doc.
What is to be explained? That's what I'm not able to understand. What do you want me to explain again?
Sir, which part we have to stabilize?
The opposite ilium.
Okay, sir.
Anything else to repeat? I'll repeat the last ones. Knee 90 degree, external rotation 40 degree, hip extension 23 degree, stabilize the opposite ilium, and resist downwards. Resist downwards, making sure the hamstring is not recruiting. So you're in the between the part and pushing it downwards. This is the test of the G max iliac division. Everybody clear now?
Yes, sir.
Clear, doc. Thank you.
Okay.
Yes,
Thank
sir.
you.
Yes, sir.
Everybody clear now? Good. So that was for the iliac division. Going to the next point. Once you muscle test, this is the position: 90-degree, 23-degree extension, and 40-degree external rotation. Same picture again. Now the difficult part here is the testing is in the prone and the visceral organ balance is in the front. Now it's not that difficult if you can understand, if you have the good palpation skills, but if you don't, then this would be a bit challenging for you, because you have to palpate the 5th and the 6th rib. You have to palpate the 5th and the 6th rib, intercostal rib, or the 6th and the 7th intercostal rib, which is near the tip of the xiphoid, and both are on the different side. So first one is the 5th and the 6th rib on the left side. So if the client is prone, this is the left side. Now putting it, my hand can be on the 5th and 6th rib, which is on the, just find the sternum, the base of the sternum, go above, and this will be 6th and 7th, and just above is the 5th and the 6th, or just below the nipple level, I would say. And you just go lateral on the left hand side, on the left hand side. This is where it relax, or you can have the fingers there, and you can muscle test whichever side you are testing. So we are testing this side. This is the left side. We are testing this side. External rotation, extension, and stabilization. Hold. Now I can have only two hands, so I cannot stabilize. For stabilization, client can use their hand on the ilia. So if you lock this, we already going to have the locking mechanism in. Rotation, extension, and we are trying to hold. If this makes it strong, that means the client need left side between 5th and the 6th rib, the visceral organ balance. This is the visceral organ balance. Okay, this is the visceral organ balance on the left hand side of the pancreas for sugar portion. This is the visceral balance.
Sir?
Yes.
So placement of other hand and grip. Can you show me one more time, sir?
Placement hand, this is the leg who is testing. Then the placement of other hand is on the opposite side, and this is the stabilization point. आपका जो हाथ रहेगा वो लेफ्ट, जो थेरेपिस्ट हैंड रहेगा वो 5th and 6th rib के वहां पे रहेगा, यहाँ पे.
तो ये तो शुरू ही नहीं.
This is where the hand would be, the 5th and the 6th rib. Okay. No. Yes.
Yes,
Yes, Dr. Mohit.
Sir, what do you mean by sugar balance?
Sugar portion. So आप देखेंगे लेफ्ट हैंड साइड में शुगर पोर्शन है 5th and 6th, राइट?
क्यों?
राइट साइड पिक्चर में लिखा है डक्ट सिस्टम. So pancreas has its own function. Each system has different sites. So pancreas sugar portion, to digest the sugar or the metabolism of sugar, would be the one that can be affecting the glutes. We are just doing the visceral balance, the sugar portion of it.
That is on the left hand side, right?
Left hand side between 5th and 6th rib.
Correct, sir. Okay, thank
The
you.
right hand side between 6th and 7th rib is your duct system balance, which is again for the glutes, iliac division. But this is on the right hand side, and rest of the test remains the same. And once we identify which makes it strong, we're going to either tap, energize, or place the hand. So while I was testing, my hand was just placed. So I would again do the placement for him. Face up. The treatment would be placing the hand on the 5th and 6th rib. What is the treatment for him? Placing the hand on the 5th and 6th. Either if you can have an energizing point, you can do that also. That is too specific. Between 5th and 6th rib, between 5th and 6th rib, if you're energizing this point, you are strengthening for the visceral balance on the iliac division of the glutes. And if I want to do both, I can do both if they both test positive. If it is difficult for you to place the hand underneath, you can ask the client to place the hand in the prone position, and you can do a muscle test while stabilizing the hips. Okay. वन साइड है ना, बट हम दोनों करेक्ट कर रहे हैं if they both test positive. Pro, I'll show you the way the client does it. If we are going to ask the client, so I'm going to ask the client to do the right side. I'm going to ask him to place the hand on the 6th and 7th rib right over here. Okay, relax. While I'll be muscle testing the muscle with stabilization of the opposite hip, up, external rotation, up, and you'll be testing it. This tests strong. So if it tests strong, that means he can energize that point for the visceral balance of the pancreas part to it. Everybody clear? Anybody who is not clear to this part of the session?
Clear, doc. Thank you.
Sir, please
Yeah.
explain again.
Explain what, madam? That's what I'm trying to say. What is that you're not able to understand?
Sir, hand placement.
Please just don't say explain again. Explain again takes from zero. What is the part you're not able to understand?
Sir, hand placement बता दीजिए.
हैंड प्लेसमेंट मैडम यहाँ पे जो है 5th and 6th रिब के पास रहेगा और
Okay.
यहाँ पे है 6th and 7th रिब के पास रहेगा. वो
Okay.
पिक्चर में भी हमने शेयर किया है. हाँ,
Okay, sir.
जो राइट हैंड साइड है वो डक्ट के लिए रहेगा, जो लेफ्ट हैंड साइड है वो शुगर पोर्शन के लिए रहेगा. जस्ट हैंड प्लेसमेंट. ओके,
So which conditions we have to use?
दिस इज फॉर ग्लूटियस मैक्सिमस ओनली मैडम. Gluteus maximus iliac division.
Okay, sir.
If that is strong, that means the iliac division needs the vessel balance. Yes, Taranjit.
सर इसमें अभी जो आपने एनर्जाइजिंग वाला पॉइंट बताया, इसमें आपने इलियम स्टेबलाइज नहीं किया था,
किया ना मैडम.
अपोजिट हिप स्टेबलाइज
मैंने
किया.
उसने रिब्स को टच किया तो मैंने ऑपोजिट इलियम को
हाँ.
टच किया.
ये
अगर उसने
अच्छा.
खुद मैंने उसको टच किया तो उसने इसके इलियम को स्टेबलाइज किया. somebody is
Okay.
stabilizing.
ठीक है सर.
दोनों
Thank you.
कैरेक्टरिस्टिक्स बताया. अगर पेशेंट खुद एनर्जाइज कर रहा है तो मैं सपोर्ट कर रहा हूँ, अगर वो मैं टच कर रहा हूँ तो वो स्टेबलाइज कर रहा है. आइदर वे मैंने दोनों पोजीशंस बताए हैं.
ठीक है सर. थैंक यू.
सर जिस साइड चेक कर रहे हैं उधर 5th 6th
Please
पे
raise your
रखेंगे
hand. I
फिंगर.
don't know who you are, and turn on your cameras. Who is it? आप क्वेश्चन पूछ रहे थे सर. विनोद कुमार चौहान.
हाँ जी सर.
हाँ, आपका कैमरा
मैं
ऑन
आज-
करिए.
सर कैमरा मेरा ऑन है.
नहीं दिख रहा है. दिव्या जसूजा, कैमरा इज ऑफ. कैमरा ऑन में ब्लैक नहीं आता है.
सर इसमें ब्लैक आ रहा है मेरे में सर. आपका जो दूसरा वाला कैमरा है.
सर मेरे को सब में दिखाई दे रहा है. आपका कैमरा बिल्कुल भी ऑन नहीं है.
अभी मैंने ऑफ करके फिर ऑन किया सर.
अब बोलिए.
सर मैं ये बोल रहा था जिस साइड का हम लोग टेस्ट कर रहे हैं, लेफ्ट या राइट जो भी, तो 5th और 6th रिब्स पे उस साइड हाथ रखेंगे, दूसरी साइड 6th 7th पे.
यस.
ओके, थैंक यू.
Yes. Any other questions? Anybody who is not clear? Everybody clear with the concept? So if you are testing, I'm again sharing the screen. If you are testing the visceral organ, we are testing that iliac division का visceral organs कैसा है. हम टेस्ट कर रहे हैं iliac division का visceral organ balance चाहिए कि नहीं चाहिए, उसको visceral से affected है कि नहीं है. If it is affected, we would get to know by putting the hand on the 5th and 6th rib for the sugar portion and the duct system from the right hand side. That's it. Clear? If that test strong, अगर मसल स्ट्रॉन्ग होती है तो हमें उस पॉइंट को एनर्जाइज करना है. अगर मसल स्ट्रॉन्ग नहीं होती है हमें नहीं करना है. That's it.
थैंक यू सर.
The next is the cranial balance. For the cranial balance, it's a nasal concha. Now, you won't be putting the fingers within the nose, but you can put it outside and just rub it slightly. So here the testing would be supine. Supine. This is where the nasal concha is going to be. Okay. This is where the nasal concha. Now the testing would be difficult. So either I can first stimulate. I'm not pressing the nose. I'm just rubbing outside the nose vein. If you're going to see it carefully, I won't be pressing the nose. Here is not what you're going to do commonly. Okay. This is where we are just pressing. See my nose, this is not what I'm doing. This is not what I'm doing. I'm just rubbing it outside. So my nose is always dilated. It's the nasal concept outside. It's on the wall. Okay. You just have to rub the walls and not press the nose. Not press the nose. Okay. Your screen is not visible. I think I'm visible. If you not see the admin, if you see just muscle matter wala screen, to main visible hu. If you can pin me, you can see me better. Bilateral, yes. It's bilateral, yes. Okay. Now the idea is do not press the nose. Not pressing the dilatation. We have to keep the nose dilated. Just the external foci, we're going to press it bilaterally, making sure 2 finger and a thumb, and while testing it. Okay. Now the question is, you can do it in prone. You can ask the client to hold the nose part, the external part, while you're muscle testing. If that test strong, you're just going to massage this part. You're just going to massage. It's going to ask for tap. It can ask for tap. It can ask for massage. Okay. Or you can ask for left and right nostril breathing. Whatever comes positive. Whatever comes positive. These are the 3 most common ones that can come positive. Okay. So one side glutes can be weak because one side nostril is not able to breathe. One side glutes can be weak because one side nostrils cannot be breathed. So you have to just rub it on that side and ask the client to breathe. And while focusing on the glutes, automatically you will see them firing. So to muscle test it, we're going to have the client in again prone. And I'm going to ask the client to hold the nasaris, hold the nasal part, while I will be testing it into the external rotation. Great. Stabilizing the ilium for him and muscle testing him. So that test strong. Now I have to muscle test. Does it need to press? Now you can just do an alternate breathing. Close one nostril and just keep the finger on the one. Close one nostril and just keep the finger on the second one. So he's going to press one nostril and not press the another nostril to see does he need a breathing part for it. Hold. That test stronger. If that test stronger, that means he need to focus the breathing pattern on this side of the nostril, just keeping the hand, not pressing it, and pressing the opposite side so that this side nostril gets stimulated for breathing only. Everybody clear? Karanjit, clear? Good. Finally you got it. Everybody clear?
नाक खोलेंगे इससे?
Excuse me sir, हमें opposite side वाला nose को rub करना है.
नहीं, जो साइड का मसल है वो साइड का करोगे नॉर्मली.
Same side.
नाक खुलेगी इससे? नाक खुल जाएगी?
अबे जी मैं उसका बता रहे हैं, उसके लिए क्रेनियल बैलेंस होता है, ऊपर का काम
नेक्स्ट पॉइंट.
Clear doc.
नाक खुलेगी कि नहीं?
हाँ नाक तो खुल जाएगी, करके देख.
The next one is the foot balance,
उस पर डाल दे वीडियो को.
in which it's a second phalanx proximal part. Second phalanx proximal part. So I can just give a hold to it while I'm testing. Extension, stabilization, stabilization, because my hand is busy with the phalanx. So I'm holding the proximal phalanx, not the distal. I'm holding the proximal phalanx, hold it, and it tests weak. That means he doesn't need it. That means he doesn't. If this tests strong, then this needed. Now, if it is second phalanx, you can massage. It can ask for rotation. It can ask for massage. It can ask for tap. If it asks, it can ask for tap. Okay, it can ask for rubbing. These are the common things the client can ask for, but it's a second phalanx that is going to affect the iliac division. So if the second phalanx is affecting the iliac division, then you have to work on the second phalanx proximal division. Okay, everybody clear with this part? No? Yes, Swati.
Then this foot balance means?
Foot balance means the foot is affecting the iliac crest, the gluteal part. The second phalanx proximal division is affecting the gluteus part of the iliac division.
Okay.
Like
Okay.
every facial bone is connected with one muscle. every foot bone is connected with one muscle, every muscle of the body. If that bone is in a characteristic position, it is deformed or it has a load, it will have its own pain and it can affect the simultaneously muscle.
So
Clear?
this will resolve the issue, sir.
Madam, resolve
Or
karne
we
ke
need
liye.
to work on the foot.
No, we are working just by balancing it. So we just need to either rub it, it's going to ask for rub, tap, slowly, maybe massage, whatever it can ask for. Yeah.
Okay. Thank you.
The ladies wear toe ring that can affect the Gmax. Yes, it is to calm your Gmax. If you're going to wear the silver one, it's going to calm the Gmax. If you're going to wear the, what do you call it, the metal one, it's just going to screw it up. Yeah, gold is to energize. If you want to strengthen it, you wear gold, but normally it is for calming down. Glute max is a muscle of sexual activity, so in order to calm the energy down, we use toe ring. If you want to activate it, we use it, the gold ring. It helps in grounding. The next one, neurovascular point, that is on the lateral squamous suture, ½ inch anterior to the astrium. So it's right over here. Right over here. If I just go behind the earlobe, 1 inch behind the earlobe, right over here. Okay, approx 1 inch behind the earlobe. We have him again. I can just place the hand. You can stabilize the pelvis, get it up, rotate, and muscle test. And this test strong. This test strong. So what I can do is just stabilize, energize bilaterally, and this is not the correct position to energize. I'll have him either prone or supine to energize it. So it's 1 inch above, that is approximately 2 fingers behind the ear canal. Bilaterally. This is neurovascular point. It will increase the blood flow to the glutes. It will increase the blood flow to the glutes. Everybody clear? No? Yes?
Click doc.
Neurolymphatic. Right posterior side, 10th intercostal space, 2 inches off the spine. For neurolymphatic, again posterior, 10th intercostal space. The inferior rib is 7th, 8, 9, 10. Right hand side, 2 inches, that is approximately 3 fingers, right over here. So it will be the 10th rib, 10th vertebrae, 2 inches off, only on the right side for neurolymphatic drainage for either hip. Up, test strong, so lymphatic will help him. Just, it's only on one side, so you always do on the one side. Either you're testing the left or the right, it's only on the one side. Even for the right side, for the left side it will be this, and for the right side it will be this. There is no second point. Like neurovascular, there are 2 points, but we couldn't show it in the skull because the picture is 1D. This is only on the right side, it's not bilateral. Here the nutrition is enzyme pepsin. Here the nutrition is enzyme pepsin. So we have the enzyme nutrition. We can just see the muscle test. Hold on. Rotate, external rotate. Hold. Strong. Just have it on the body. Hold. Better. So this will help. This will also help the iliac division. So if the client is having low pepsin, that will also make the glutes weak. Low pepsin, that will also make the glutes weak. So as we have covered for iliac division, we have covered multiple aspects like the visceral balance, The visceral balance, that is the sugar portion, the pancreas left inside, fifth and sixth rib. The pancreas right side, that is sixth and seventh rib. The cranial balance, that is on the nasal aspect, not pressing the nose. Foot balance, that is second phalanx proximal part. Neurovascular from the ear canal 1 inch behind. Neurolymphatic, that is at T10, 3-finger width out. And pepsin.
Sir, I have a question. Is it like in neurolymphatic, do we have to do contralateral side, or it is like always on the right side?
It's always on the right side.
Okay, thank you, sir.
Doesn't matter which leg you're testing. Okay? Everybody clear?
Sir,
Okay,
please,
thank you.
excuse me, sir. Sir, please tell me the position of fingers in neurovascular balance.
Neurovascular balance is from the ear canal 1 inch behind, right over here.
Okay, sir. Means 2-finger, too soon.
I have just two finger.
Okay, sir.
Yes. Anybody else? Done? Can we move on to the next part of the muscle?
Yes, sir.
Teeth, madam, overall का आता है, individual का teeth नहीं आता है. शुभांगी मैम. The
Okay,
next
sir.
one is the GMAX sacral division. GMAX sacral division. To muscle test this, we're going to have it 90-degree knee flexion, 23-degree extension, but there is no rotation. Rest is all same, but no rotation. Everybody clear? So if I'm going to muscle test this time for the sacral division, the knee would be bent, it would be off the table and stabilizing the opposite ilium. I'll be pressing down with no rotation of the femur, no internal, no external. It's neutral. It's neutral. If the client find it difficult to hold, when I take it up, they either rotate internally or externally. They are using excessive of ilium or the other muscles, but not the sacral muscle. Lot of clients won't be able to hold the knee into the extension position itself and do an extension. So 90 degree ले जाके extension 23 degrees नहीं कर सकते हैं. Either while doing that, they will rotate internally or externally. If they're doing internally or externally, they're using other muscles like coccygeal or the ilium part, but not the sacral part of the glutes. If the sacrum is affected, sacral part of the glute will be difficult to recruit, so they will either internally rotate or externally rotate to recruit the other muscles, mimicking the sacral division. So while testing, if you see a client, when you bend the knee and when you ask them to extend the knee to get them to the testing position, and suddenly they externally rotate or internally rotate, that means their sacral division is off. It's a classical symptom. It's a classical symptom. But if you want, like he's trying to go up, but with keeping it in the internal rotation. So that is making sure that it is, he's using his coccygeal division for the sacral division to fire, which is again a trick movement. So just go extension, no hamstring firing, and you press down. That is for the testing of the glutes of the sacral division. Everybody clear? Anybody who's still not clear? This is the picture. It's 90 degrees. Everybody clear? Yes, Tanisha, you have a question.
सर जो आपने हैमस्ट्रिंग रिक्रूट वाला इसमें एक पॉइंट बताया वो एक बार रिपीट कर दीजिए.
अगर आप hamstring short रहेगी तो hamstring tight मिलेगी, so it should be not over firing. Normally clients would use their hamstring, so they can, instead of having a knee 90 degrees, the knee would be either more than 90 or less than 90. If it is either more than 90 or less than 90, the client is recruiting the hamstring for the glutes.
तो उस कंडीशन में हम कैसे उसको
90 पे लेके आओ, या तो फिर आप पहले hamstring को बैलेंस करो.
ब्रेक इवन दोनों दिन.
थैंक यू सर.
If the glutes are completely inhibited, they will definitely use the hamstring load. So first we activate the glute, then we work on each division, which one they need to work on.
Okay,
Clear?
sir. Yes, sir.
Perfect. Anybody else who is not clear? Divya Jasuja, your camera is off. Jagun,
ये डाल
this
रहे
is
हैं
the last
इसमें
warning.
क्या होगी जो
Admin, please start placing people whose cameras are off.
मेरे को
Karanjit,
नहीं चलेगा पर मुझे दिखेगा कि हो गया
यस सर
क्या दिखा रहा है
सर वो कॉक्सिजियल डिवीजन वाला जो पार्ट आप अभी
आया ही नहीं,
बोले
मैंने
ना
पढ़ाया ही नहीं, आपको समझ में आएगा ही
नहीं
नहीं,
नहीं
छोड़ दो।
नहीं सर वो अभी यही वाली की टेस्टिंग मसल टेस्टिंग के लिए आप बता रहे थे ना कि हिप एक्सटर्नल या इंटरनल रोटेशन में जाएगा मतलब सेक्रल डिवीजन ऑफ है और फिर एक और पॉइंट आपने बोला था कॉक्सिजियल डिवीजन यूज कर रहा है ऐसा कुछ
हमारे 3 डिवीजन है ना,
हाँ
3
यस
डिवीजन
सर
है, इलियक,
यस सर
सेक्रल,
हाँ
कॉक्सिजियल। इलियक डिवीजन हमने देखा एक्सटर्नल रोटेशन करके 40 डिग्री आया।
हाँ सर
अभी हम कौन सा कर रहे हैं? सेक्रल 90 डिग्री है।
सेक्रल यस सर
बस बाकी अभी तीसरा पढ़ाएंगे तब आ जाएगा, वेट।
अच्छा ठीक है सर
यस जागुन।
नो एमबी की इसमें डाल दूंगा
So the enzyme is pepsin. So enzyme is because of the shape of the muscle. It is like related with the stomach, or
Stomach.
it's just okay.
Glutes has to do with sex. Sex has to do with satisfaction. Satisfaction has to do with stomach.
Okay.
Pepsin comes with digestion. So people who overeat or undereat, if they are having a weak sexual appetite, that will affect the glutes indirectly, directly.
Okay.
Sometimes people eat to satisfy themselves for their sexual needs. And if you are sexually affected, definitely you may end up having acidity or maybe no hunger at all. So pepsin will decide how much to digest the food.
अभी डॉक्टर
Clear?
Yes.
Perfect. Shall we go to the next point?
कैसे
The
होंगे
next is again the visceral balance of the muscle. The visceral characteristics of this muscle is posterior pituitary, edge of the umbilicus at 4 o'clock. Posterior pituitary, edge of the umbilicus at 4 o'clock. The client is supine. Okay, for umbilicus 4 o'clock. You can have a clock here, please, and this would be the 4 o'clock. Okay, usually it comes with a tap. Usually this side comes with a tap. That's very common. And a slow, easy tap. Definitely you can't do a muscle test and the tapping simultaneously. So I can do a pre-muscle test, whatever the position of the muscle is. I can tap for 30 seconds and again do the muscle test. If that makes it weak, then we're just going to leave it. We don't need it. If we make it strong, we continue it for 2 to 3 minutes so that it can get stronger and stronger. Clear? So while doing this, after doing this, we're going to have the client again prone line for testing of the sacral division of the glutes muscle. Everybody clear? This is on the umbilicus. So you have to find your navel. Definitely can't see mine, but assumingly this button is the navel, and at the 4 o'clock you're just going to tap. Okay. So this button is the navel approximately. It's not the navel, but still it's the navel. At 4 o'clock you will just tap. Clear? Once you're done with 10 seconds tapping, you can again do a muscle test. That will be the best part for you to do it. The second visceral balance here is the prostrate or uterus, that is posterior bilateral inferior lip of the acetabulum at the level of bladder 49. So that's around the iliac division. This is GB30 and bladder 49 is more medial to it. If you're not clear with the site, you won't be able to see it. you can Google the site. That will be the best thing. You can look for the Google itself, the bladder 49 position. Once you're able to know it, that will just make it easier. Okay, so if it is not visible, it will be hard for me to explain in standing or in prone lying. It's still not clear, just Google the site, you'll get the bladder 49 exact position, and you just need to place the hand, energize it. I'm going to place the hand, energize it, and again test the, which one? The sacral division of the glutes, stabilizing the hip, 40, and hold. And while he's holding it, so he's trying to extend the knee to hold it. That is a clear indication he's using the hamstring instead of glutes. Hold it. Again, he extends the knee. So for him, his sacral division, he's using the extension of the knee. And this can help, yes or no, we'll just see. So we'll just do bladder 49 energization, maybe for 30 seconds or a minute, and then we'll re-muscle test. If the recruitment reduces, if the recruitment of the hamstring reduces, it's a clear indication letting us know that the sacral division is now firing. The sacral division is now firing, and the client may need the visceral balance. He may not need it. It can come negative also, but just for the curiosity, I'm doing it. Up. He's not extending the knee. He is not extending the knee, even though the strength remains the same, but the recruitment of the hamstring itself reduced. That tells us that the gluteal firing has increased, even though the strength has not increased. Everybody clear with the idea? Yes, no?
Sir, please explain the position again for posterior pituitary and prostate or uterus.
Bladder 49.
Okay,
If
and
you're not
what
able to
about
clear, I would say please Google it up. You'll get it directly.
posterior pituitary, sir?
Is
4
bladder
o'clock.
49.
सर 4 o'clock वाला पोजीशन जो आपने
4
नेवल पे
o'clock वाला umbilicus था, वो posterior. Okay. Posterior pituitary at 4 o'clock. So this is the button. 4 o'clock.
So we have to
After
just
clock,
place the hand, na?
bus place the hand or tap.
Okay. Okay, sir. Thanks.
Okay. Yes, Nidhi.
यही वाला पूछ रही है
Sir, you are saying the
देखो
umbilicus is the center of the clock. So 4 o'clock would be laterally somewhere on the left hand side downwards, no?
Yes, तो ये left hand side है.
हाँ, but downwards ना.
Downward
आप
तो है.
एकदम umbilicus
ये
वो बटन बोल
ये umbilicus button है.
हाँ.
This is 12 o'clock, 3
हाँ हाँ,
o'clock,
तो
4
3 आ
o'clock.
गया, उसके लेटरल में 3 आ गया, तो नीचे होगा ना, ऐसा
हाँ
बोल
तो
रही
वही
हूँ.
तो रखा मैंने 4 o'clock यूं.
ठीक
अब कैमरा में वो वैसे दिखेगा.
हाँ, ऐसा दिखने रहा. ठीक है, ठीक
आगे
है.
बढ़ते हैं सही
Thank you.
4 बजाओ. Okay.
हाँ.
Anybody else? This is the left side. Thank you. This is my right side. Yours is opposite. Shall we go to the next point? Thank you. The cranial division. That's the TMJ joint. So a lot of people find clicking. That can be because of the sacral division. One side clicking, one side sacrum can be off, or it's a TMJ joint itself. So you just have to place the hand right at the TMJ joint, where the joint line is, anterior to the tragus, and you can have the mouth closed and have a muscle test. Stabilizing of the opposite side. Hold. Or you can have mouth open and a muscle test. Hold. And that makes it weak. So he needs for the mouth closed position. Which one? Mouth closed position, and we are just going to stabilize this side. You can just energize this side. Usually it's 5 finger. Or I get a light brushing. A very light brushing. Normally it's 5 finger. That's 80% of your client. But people who lack nurturing, and because of that they have stress, they would like brushing. They would love brushing. Just run the fingers here. Everybody can see it? No?
Okay,
Okay.
Yes, doc.
Brushing. Okay. If you see, these people can be like, they can have beard, and a lot of people just keep doing this, smoothing that beard. दाढ़ी को सहलाना उनको अच्छा लगता है. That calms their system down, especially the sacral division of the glutes.
डाल देना ऐप डाल दे यार,
Clear?
दिख जाएगा मुझे भी.
They keep rubbing the hands.
Audio
Yes.
recording कर रही है, बंद हो जाएगी.
Sir, you said if the muscle is strong, then only we do the balancing. तो यहाँ पे तो weak आया है. So why
हमने
do we
दो
do
पोजीशन ली थी इसमें सर, एक माउथ क्लोज, एक माउथ ओपन. माउथ क्लोज में स्ट्रांग था, माउथ ओपन में वीक था, तो हमने माउथ बंद करके किया था. Okay, does that help?
Yes, thank you, sir.
Yes. Yes, Swati.
यस सर. सर जिस साइड का हम टेस्ट कर रहे हैं उसी साइड का
This
TMJ
is bilateral, no one-sided. This is bilateral. Either side you have to test bilaterally, not one-sided.
ओके सर.
Test भी bilateral होगा और करना भी हमें bilaterally. If you can't put two hands, like the client put their hand, rest you do it on the table.
ओके सर.
Clear?
यस.
Good question. Thank you. The next one is the foot balance. That is on the big toe. Distal phalanx, big toe. So it's a big toe distal phalanx right near the nail, Okay. So either the client can stabilize his hip, stabilize the opposite hip. While I'm putting the hand on the big toe, and I'm going to ask him to test. Hold. And that is strong. So either I can just massage the big toe, I can just rub it or press it. Okay. Normally I get is pressing. I don't get massages. People don't ask massages from me. They ask for pressing. So I press and the client can jump off the table while pressing. That's normal. Okay. And then you again muscle test and see how is the sacral division of the same.
Jump off क्या दबाया?
Excuse me, sir.
ma'am.
Sir, we have to just press the nail of the big toe.
Lateral to the nail of the big toe.
Okay, lateral. Okay, sir. Means outside.
Yes, madam.
Okay,
It's the distal phalanx that you're going to press. Clear?
नाखून प्रेस किया.
Everybody clear? Great.
Yes, sir.
The next is the neurovascular, which is in the posterior bone-like position between the lateral lambordal and halfway between the astrian suture. So some people don't really understand that part. So we're going to say earlobe, ear canal, and the center of the head right over here, and the midpoint. That just gets a bit easier for the client. Okay. So this greater protuberance, ear canal, midpoint. Greater protuberance, the lesser protuberance, sorry, not the greater, the lesser protuberance, the ear canal, and the midpoint. So this is the site. Again, it's bilateral. Again, it's bilateral. Okay, so I can have two fingers directly over it, like my hand, stabilize. And I'm going to muscle test, 90 degree, hold. And it is strong. So neurovascular will help his sacral division of the glutes relax. And usually it's a 5-point. It's a 5-finger. That's the common one. Others are less common. I'm not saying the others won't come. It's just less common. That's neurovascular. Neurolymphatic is again posterior rib. This time it's the 4th and the 5th spine. This time it's the 4th and the 5th spine. Previously it was the 10th rib. This time it's the 4th and the 5th spine. So inferior angle of scapula, there is 7, 6, 5, 4. 4 and the 5th spine. 2-inch lateral, that is 3-finger width approximately, right over here for either left and the right, both glutes. Okay. So this is between the 4th and the 5th spine. Sorry, it's been wrongly placed. The dot has been wrongly placed. It has to go above in the scapular region. fourth and the fifth rib. Okay, the dot has been wrongly placed. Please do not follow the dot. It's been wrongly placed by me. I apologize for that. It will go above fourth and the fifth rib. It is around the above the scapula, between the scapula, above the scapula. Yeah, inferior angle of scapula. So you go from the scapula above. That's at the seventh level. 6, 5, 4. If you're going to palpate, it's right over here. Okay, and if you muscle test it, if you energize it, like I'm doing already to him, already more than 30 seconds, and if you muscle test up, every time now he's going up, he's not extending the knee, he's not extending the knee, or he's flexing the knee. That is a classical characteristic that the sacral division has started to recruit. That is a classical characteristic that his sacral division has started to recruit. Yes.
बीच में क्यों बोल रही है? क्या फर्क पड़ गया?
अरे उसकी
Yes,
टांग
Taranjit.
ऊपर उठने लग गई ना।
सर ये जो आपने न्यूरोवैस्कुलर वाला आपने बताया था ना, उसको एक बार स्क्रीन पे दिखा दीजिए, पीछे पोजीशन
ये रहा,
आपके स्कल के ऊपर।
मेरे स्कल
ये
पे और
वाला
नजर नहीं आएगा आपको।
सर ऐसे पीछे से आप बताते हैं ना, टर्न होके।
ये रहा, आ गया समझ में?
यस सर।
Thank you. Anybody else? Anything else?
एक्सक्यूज मी सर,
Yes.
न्यूरो लिम्फेटिक बैलेंस में आपका प्लेसमेंट बता दीजिए एक बारी। अबव द इंफीरियर एंगल ऑफ स्कैपुला बताया ना आपने, सो वी हैव टू यूज आवर 5 फिंगर्स।
Scapula, fourth and fifth rib, यहाँ पे आएगा. This is where it is.
So we have to just rub or press.
Just touch, no rub, no press.
Okay sir.
Just touch, no rub, no press. Just touch. Neurovascular, neurolymphatic are always touch, no rub, no press. Yes, Trupti.
सर क्रेनियल बैलेंस जो आपने बताया था टीएमजे में,
हम्म.
उसमें क्लोज माउथ और ओपन माउथ से क्या डिफरेंस आता है?
So some people can hold the stress while open. The jaw responds differently in an open mouth and a closed mouth. The receptor forms differently. So how your jaw, since we're talking about TMJ joint would react differently being closed and open. And that is how the muscle would also respond. Some muscle respond better with open mouth, some muscle respond with closed mouth. It's the same muscle, how it responds in two different environments that needs to be tested. The environment it needs a support is where we are giving him support. अगर client का दांत चबा के strong already है and he needs a more strengthening in the open mouth, that means a relaxed position of the jaw, then you have to strengthen him in the relaxed position. You can't strengthen him in the closed position. नहीं समझ में आया?
नहीं।
So मान लो client का jaw already strong है in the closed position, client's position. आपको स्ट्रेंथनिंग करनी है किस पोजीशन में? आप
ओपन
So what would you keep the mouth, open or closed?
ओपन
But client के लिए क्या है easy, open या closed?
क्लोज्ड।
So what he will keep?
क्लोज्ड।
Recruit करने के लिए तो वो easiest रास्ता closed ही लेगा ना. हमें टेस्ट करना है कि closed में है कि open में है, उसको किसमें चाहिए.
Okay.
So in close he might test weak and in open he might test strong, because close में already over empower कर रहा है, open में power ही नहीं कर रहा है. तो आपको बॉडी बताएगी नहीं मुझे ओपन में चाहिए, आई एम टेस्टिंग स्ट्रांग, गिव मी दिस, सो यू विल गिव हिम दैट.
ओके,
नहीं आया? समझ में नहीं आया?
वो रिक्रूट कर रहा है वो मसल्स, दैट्स व्हाई स्ट्रांग और क्लोज हो रहा है वहां की टीएमजे मसल, उससे रिलेशन है उसका.
यस,
पोजीशन से. ओके,
व्हिच पार्ट ऑफ द मसल ही नीड्स टू रिक्रूट, दैट्स इट.
ओके,
यस अंकुर.
थैंक यू
सर. वो न्यूरोलिम्फेटिक पॉइंट में ना सर वो लिखा भी ऐसा ही है कि 4 to 5
रिब है, वो रॉन्ग है, मैं वही बोल रहा हूं. इट्स अ फोर्थ रिब. माय मिस्टेक, आई एम ऑलरेडी सेड इट. इट्स अ माय मिस्टेक, आई हैव रिटन इट रॉन्ग. इट्स अ फोर्थ intercostal rib, 2 inches lateral. Please make a correction on it. Remove kar do one. Vinod Kumar Chauhan, you can only join with one device. You have two devices on. Please make sure it's only one device.
Good morning. Good morning. Good morning.
Good morning.
Oh.
Gluteus maximal coccygeal division, the next one. The coccygeal division is where it's bit tricky. It's bit tricky, which you have to understand. You have to bend the knee at 90 degrees. You have to bend the knee to the 90 degree. Place the knee on the opposite popliteus. Stabilize with your knee on the opposite side. Admin. Everybody clear? Again repeating. Again repeating. Bend the knee to the 90 degree. Place the knee on the opposite popliteus. The knee is on the opposite popliteus. You can see it on the admin part. Isko stop kar do. Stop sharing. Up, 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 up. Upar lal hai. Place the knee on the opposite popliteus. Stabilize this knee with your knee joint. Okay. Resistance would be internal rotation. That is the test. This is the brake test. Hold, and I want to come on the internal rotation. This is the coccygeal test. Again repeating the test the last time. It is the last time. Please make sure you see it. Bend the testing knee to the 90 degrees. Keep the affected knee on the popliteus of the opposite knee. Stabilize the knee so it does not falls off. The hand is on the lateral aspect of the ankle joint, and you're going to force towards internal rotation, asking the client to hold, and I'm going to go in the internal rotation. If the client bends the knee or extends the knee, he is recruiting hamstring for the coccygeal division. If it is neutral and I hold, that is for the coccygeal division. If the legs goes out, that means the coccygeus is weak. Coccygeal division of the gluteus maximus is weak. My apologies. Everybody clear?
Good job.
No? Yes?
Yes.
सबको दिखाई दिया बराबर?
Excuse me, sir.
Yes, ma'am.
सर अब अगर नी बैंड और एक्सटेंड करेगा देन
Bend and extend करेगा तो hamstring यूज कर रहा है मैडम. पहले आप glutes को एक्टिवेट hamstring बैलेंस करिए. That's what we are trying to say. If he is using the hamstring, that means the muscle is not working. फिर हमें ढूंढना है neurovascular, neurolymphatic या neuroreactives. What does he is using to clear it off so that he can do it?
सो सर मसल टेस्टिंग में हमें मतलब ढूंढना पड़ेगा कि कौन सा.
Yes, ये वाला टेस्टिंग से ढूंढना पड़ेगा. Thank you. You missed the nutrition part of the sacral division. That's vitamin E. Okay, that's vitamin E. Shall we go ahead now?
Yes, sir.
Thank you. To take the position, it's difficult for many clients. If it is difficult for many clients, go as close as possible, lock it, and then do an external rotation. You may not touch it. Some people are too healthy, or they may not be able to touch the thigh or cross it on the other knee. It's fine. Go as close as possible to the knee. Lock your knee with the knee and then try to do the rotation. If they cannot take to that position itself, that means the coccygeal is completely stretched. It's not functional at all. It should go. If it is not going, that means you have already a locked muscle. Sorry. Now you can work on it as a reactive and other functions so that it can start going. Clear? No? Yes?
Yes.
Kind of? Yeah, glutes have a lot of question marks on your face.
Split drop.
So that's the same test I've shown on the opposite side standing. I'm not stabilized with the knee so that you can see it what I'm doing it, but this is not the ideal way of testing because it consumes a lot of your energy and your body posture is getting affected. So what I've shown is the correct way. This is just for the muscle, just for the picture, just to understand. The visceral organ balance is at 4 o'clock inferior bladder on the rectal orifice, and the sphincter extension, that is 10 o'clock on the rectal orifice. So there are, both of them are on the rectal orifice. It's one at the 4 o'clock, another one is at the 10 o'clock. Rectal orifice is right in the behind, so it's not that difficult. Imagine it's over here. 4 o'clock is right over here, and 10 o'clock is right over here. If you're not comfortable, just keep 2 inches off the table and stay there for 30 seconds or so, or you can ask the client to put their hands itself. So wherever they can find the rectal orifice, at 4 o'clock you're going to put the hand, and 10 o'clock would be on the opposite bum. Clear? As close as possible. Do not put directly around the hole, around the rectal orifice, or the do not put the hand directly around the rectal orifice. As close as possible, and just touch the hand around it, you will get the same response. So for the bladder response, I'll be doing at 4 o'clock, and extension, hold, and that makes it strong. That makes it strong. So if it makes it strong, definitely I can energize more for the bladder division at 4 o'clock.
दूसरे कैमरे में दिखा सकते हैं क्या ये?
हाँ सर.
सर इस कैमरा में इतना सर विजिबल नहीं है, बहुत दूसरा वाला जो कैमरा ज्यादा विजिबल है सर उसमें.
दूसरा वाला कैमरा सर पॉसिबल नहीं है
इस, हाँ.
दिस इज द रेक्टल ऑरिफिस. यहाँ पे आपका रेक्टल ऑरिफिस है, इसका 4 o'clock पे आपको हाथ रखना है, और 10 o'clock पे हाथ रखना है. 10 o'clock इज द कोलन, 4 o'clock इज द ब्लैडर. अगर ये आपका रेक्टल ऑरिफिस है,
या
4 o'clock पे रखना है. क्लियर?
ठीक है. ओके,
थैंक यू.
एक्सक्यूज मी सर.
यस मैडम.
30 सेकंड के लिए रखना है या 1 मिनट?
आपकी मर्जी है, जितना मसल टेस्ट में आएगा उतनी देर रखना है. वी डोंट प्री डिसाइड.
ओके ओके सर.
Testing is just for testing. Treatment time can vary from 30 seconds to 5 minutes, 7 minutes, 10 minutes, depending on the client. Okay. The next is the palatine. The palate is the roof of your mouth, right? So just ask the client to touch the roof of the mouth and then muscle test. Definitely you can't see it. Ask the client to muscle test. Touch their tongue on the roof of the mouth while I'm muscle testing it. Stabilize, hold, and that test weak. If that test weak, that means the client does not need palatine stimulation. If the test is strong, that means the client needs it. So him, he does not need a palatine stimulation. If he did, you would ask him to touch it as much as possible. Stay in there. He can rub the tongue front and back, or just keep it, touch or tap on it, however he feels like. Foot balance is first metatarsal. First metatarsal, right over here. First metatarsal, just above the joint. Okay. Keep the finger there, and you can muscle test. This is not the ideal way to test. I already said that, because you won't be able to stabilize. So we'll be doing this side for you to demonstrate. Okay. So first metatarsal, stabilize, hold, and it is strong. So I can just tap, minute, 2, 3, whatever is comfortable for the client, and then again retest if required, and that keeps getting stronger. So first metatarsal has a direct involvement for his gluteus maximus coccygeal division.